Hello, myself Dr. Manajeet Patil, consultant plastic and cosmetic surgeon. Today I'll be discussing about a very commonly done cosmetic surgery procedure called liposuction. So what exactly is a liposuction? It is a surgical way of removing the excess fat. So who are the ideal candidates for this procedure? So someone who is overweight but well within the 20% of their ideal body weight, the one who has good elasticity of the skin, someone who has got a good muscle tone. In these are the cases the liposuction works really well. This is a myth that most of the patients have. They come looking for the liposuction thinking that that is likely to reduce their weights, but the answer is no. This is not a weight reduction surgery, it is a body recontouring procedure. See, someone who is on a diet and a regular exercise but still they have got a certain areas where they are finding it difficult to get rid of that fat. We call it a stubborn fat, resistance to all kind of exercise and diet, say around the trunk or so, at very specific areas. They are the most suitable candidates for this liposuction to address only a particular areas. It is not a weight reduction surgery. So when you see a plastic surgeon, so you have to discuss how the procedure is done, what liposuction it is, so what are the risk, complication, recovery time, everything will be discussed in that. So are there any types of liposuction? Yes, there are different type of liposuction based on the problem what the patient has. We do a something called as a tumescent liposuction. This is done only for the limited areas, wherein we use a mixture of normal saline or lingual lactate with the local anesthesia and with the epinephrine, so that small areas can be addressed. The next commonly done liposuction method is power assisted liposuction, which we call it as a PAL. So here what happens is we have a machines wherein the machine will move to and fro and it will loosen the fat cells and that fat will be sucked out. And the third type is what we call it wherein Vaser liposuction, wherein we use the ultrasound energy to loosen the fat cells. They'll separate the fat cells that can be sucked out, and that is how the fat is removed from your body. It is one of the commonest plastic or cosmetic surgery procedure done all across the globe. If you follow all the precautions, if you follow all the standard guidelines, the procedure is pretty safe. So most of the patients do well with this liposuction, and if the right method is followed, definitely it is a safe procedure. So you'll have a consultation with your doctor, understand all the procedure method, different types, recovery, and then get the pre-anesthetic checkup done with the anesthesiologist, get a few lab tests, and then go ahead with the surgery. So how exactly the surgery is done? Generally it is done by the, say suppose if I have I want a liposuction of your abdomen only, so small cuts will be made. The cuts will be in the size of 3 or 4 millimeter, through which will pass the cannula. And if you are using a PAL, say for example power assisted liposuction, the machine will move to and fro, it will loosen up all the fat cells and the machine will suck out all the fat. The deeper fat cells are removed and will get the proper shape what you wanted. Answer is yes. Most of the humans are born with a certain number of fat cells, especially when they reach the adulthood. The number of fat cells remains the same throughout your life. The only thing what changes is the volume of those fat cells. That is how you gain that obesity or lose that. So what happens is, once if you suck out or take out the particular number of fat cells, they are removed permanently. But in case if patient doesn't follow proper diet and exercise, so again there are chances that he may gain he may have the fat cells increase in the size, so again he'll start appearing obese. So in spite of this surgery, it is very much recommended to have a proper diet and exercise even after the surgery to get in to maintain the shape what you have achieved. You may have to stay in a hospital it can be done even if a smaller area. We can do it as a daycare procedure. Same evening you can go back, or maybe one day or so. You will have certain tubes to take out if there is any collections. There will be small bandages around it. You can move around, no issues. So you will have bruising, swelling in the liposuction areas, but most of it will subside. Temporary you may have a numbness on the skin where we do a liposuction, even that will subside. You may have to wear certain pressure garments to get the proper shape, and also to prevent the seromas. You have to wear those pressure garments for nearly 4 to 6 weeks, and you can start most of your routine workout by 4 weeks or 6 weeks, and you can start all your routine works by 4th or 5th day.